those of you who don't know me, I'm a doctor and a social scientist, and I've come to talk to you today about why technology programs in healthcare very often fail and what we can do to improve their success. So the council wanted to partner up with a tech company that were making a nice little gadget. It looked a bit like this wristwatch, but instead of the clock face, it had a GPS tracking device. So that when the person didn't come back when they were expected, or if they strayed beyond the kind of geographical area you could program in, called a geofence, the alert would be triggered and then someone could go and pick them up and bring them back home. I think fundamentally what went wrong was that in our heads, we'd taken a really complex problem and we turned it into a much simpler problem, and then we picked a technology as the solution to that oversimplified problem. Problem is, if the frontline staff, whose job it is to refer people to get these devices fitted, if they think it's unprofessional and even unethical to be involved in it, they're not going to be falling over themselves to recruit people into the study. Then there's organizational complexity. You know how complex health and care organizations are. The more a technology requires major changes in roles and tasks and processes, the less likely it is to get taken up by the organization and mainstreamed and sustained over time. And finally, there's regulatory complexity. Is this little GPS tracker a medical device? Because if it is, it's going to need to be approved by the Medicines and Healthcare Devices Regulatory Agency. Frontline staff are really good, usually, at getting the show on the road and keeping it there, using what we call workarounds, adaptive methods, agile methods, whatever terminology you'd like to use. But in order to do that, they need a bit of training. They need a bit of what we call slack resource, money and staff time that can be channeled adaptively as the problems unfold. So I'll give you my final message again. If what you're seeing is a simple problem with a simple technological solution, you probably need to do a bit more work to unpack and understand the complexities in your project, to reduce complexity in as many parts of the system as you can, and to manage that complexity using agile and adaptive methods.